Hi, everyone, and welcome to SoftFil Academy's webinar. We are so thrilled to welcome all of you, and we are going to start this webinar slowly, letting everyone connect. I wanted to start by welcoming Dr. Frank Rosengaus. Thank you so much for being with us.
Thank you for the invitation.
So I will be starting by introducing Dr. Rosengaus, and then I will let him do his presentation. And please keep all of your questions for the end of the webinar. You will have 10 to 15 minutes for question and answers. So if you could just go to the next slide, Dr. Rosengaus. And again, thanks so much. So Dr. Rosengaus is a plastic surgeon from Mexico who is a member of various associations, including the Scientific Committee of IMCAS in Paris and General Coordinator of IMCAS America. He is representative of Mexico at the International Federation of Facial Plastic and Reconstructive Surgery Societies. Dr. Rosengaus is a renowned international speaker with particular interests in face anatomy and fillers, who has contributed with new concepts and recognized techniques. He is a regular participant in various expert advisory boards and a KOL. He is also the author of the book, The Rosengaus Method, Beauty That Breaks the Mold. So we are now going to start the presentation. The theme tonight is a technique very specific to Dr. Rosengaus called the happy face treatment, aimed for the correction of marionette line and oral commissures. Thank you so much. Please note that this webinar is being recorded and it will be available on replay on our SoftFil Academy platform and YouTube platform for 30 days, starting counting tomorrow. So if you need to watch the replay, do it quickly because you will only have 30 days for this interesting presentation. Thank you so much.
Thank you, Hannah, for this introduction. And I'm going to start my presentation. So this is a happy face treatment, is a treatment that has been explicitly designed to take care of two things: the oral commissures going downward and the marionette lines. I want to start by saying that the whole technique is already published in the medical literature. This has happened in the Journal of Drugs and Dermatology in their November of 2018. So we already have 4 years with it. And there you can read about it with more calm and see what are the main characteristics of this specific treatment. And well, how does this start being a necessity? Why do I need to think how to retreat an area which all of you and myself have been treating for a long time? The reason being that the patients that come to my office are like this one, who are really complicated in the sense they're the specific anatomy of the perioral area makes this area very challenging. As you can see in this patient, it's not only the features of the lips or the specific feature of the nasolabial folds, but around it, you have multiple irregularities, lines, folds, and step-offs between one area and the other. This happens to be very, very awkward to solve with the previous techniques that I had used, which are based on the needle. So I used to put the needle, like many of you still do, and try to figure out how to take them away one by one. The results that I was getting was something like this. Also, they were better, but better was not enough. It was still lacking the uniformity and the beauty around the perioral area. So I start thinking, first of all, what are the real characteristics of the perioral area that we want, that we assume to be part of what we call the beauty of the area? Because this is a challenge. Actually, the formation of the marionette lines don't even have a specific treatment in surgery or in other types of techniques with energy devices or complex products. So we have to have a better solution. That's the challenge. And I was thinking and thinking on it that I actually saw them everywhere, like in this case. Finally, or in this case, where you have the happy face ant. So we want this happy face in our patients. But before we go into the technique, let me tell you a story. In 2014, 8 years ago, a couple of archaeologists went into this convent in Florence, Italy, looking for some remnants. And when they started digging, they actually found them. But who were these remnants from? They belonged to a woman that lived at the end of the 16th century, beginning of 17th, and her name was Lisa de Girardelli. Lisa de Girardelli happened to be married to a very rich merchant, textile merchant, who was Francisco del Giacomo. Del Giacomo, you know, the husbands want their wives happy. So he went with one of his neighbors, so that's how the story is being told, who was a painter, and asked him if he could paint, make a painting of his wife. And he did. He was paid, but the only thing is he never told him when he was going to deliver the painting. He did it 16 years after. That painting happened to be this one, which, because he was del Giacomo, she is known as La Gioconda. And that Gioconda is always mentioned in any talk about beauty. So normally I will try to avoid talking about her because I will be redundant. But unfortunately, her smile, which is not even a smile, is a smirk, is the most famous smile in the Western culture. No way to avoid it. And the painter happened to be a guy named Leonardo da Vinci. Leonardo was not only a painter, as you know, he was also an anatomist. And things happen when you mix and match different sides or different areas of science. So this guy, knowing anatomy and knowing how to paint, painted La Gioconda because he already knew how many muscles we had there and how the muscles were being pulled and moved around the mouth. So that's how he got this specific expression around the mouth, which is so famous. So as you can see, the things that I like most about the area, which all of us talk about, is that everything around it is very homogeneous. You don't have these irregularities and ups and downs, folds and wrinkles. And the other thing is that the oral commissures are going up. So maybe we have to figure out how to do this. So then I went to the second most important smile in Western culture. It's this one is a photography from Mario Testino. It's a very famous Peruvian photographer. And she took this picture of Lady D. He took this picture. If you look at that smile, you will find the same features. The surroundness is very homogeneous, and the oral commissures are going up. So now we're seeing a trend. Now let's travel a little bit to LA, to Hollywood, no? Mm-hmm. This is Robert's, the most famous smile there in the movies. Same thing. You don't see any hypertrophies, you don't see any depressions, you don't see these step-ups, you just see something very nice around the mouth. And the oral commissures going. So therefore, I figured out that I had to find out a technique to do that. But it couldn't be like this. This is something that was actually published. Can you imagine? That this is surgical. And it seems more like someone belonging to the Batman movie. What? We don't want that. We want something that it's natural, that belongs to the patient, that makes her smile in a normal way with a normal movement. And whatever we do, we don't destroy that. So let's go back to our conventional wisdom. We always think that the upper half of the face is a half where we have wrinkles, and those wrinkles are secondary to muscular hyperactivity. Therefore, the treatment for this area mostly is based on neurotoxins. That's how I explain it very simple to my patients. But the lower half was and had lines and folds that were secondary to skin laxity and loss of volume. Nobody was thinking about the muscles per se in that particular zone of the face. But the truth is, look at this, that the dynamic component of these lines and wrinkles of the lower third is very important. It's actually the most important thing that creates those wrinkles and creates the folds. The way I smile creates actually this one in myself. So let's go back and review the anatomy, specifically of the third layer, the mass layer around this area, which is composed of muscles. And believe it or not, it's not one or two. Actually, there are 8 different muscles that have to do with the movements and refinements to create all the things that the mouth has to do, from talking to smoking to kissing. So we need all these muscles. And these muscles actually get together in one single point, which you see there marked. This area, which is 1 centimeter away from the oral commissure, is called the modiolus. The modiolus means only that is where all these 8 muscles meet. And well, you can see that the different movements of these muscles creates, when they are pulled up nicely, the smile. But when they're pulled down, they create that angry face, which the marionette lines and the oral commissures are part of. If we go to that area, out of all these 8 muscles, there is one who has actually the name specific for what it does, how it works, which is a depressor of the angle of the mouth. Every time this muscle, this one, contracts